Hi, my name is Natasha. I am a registered nurse and nurse entrepreneur. I am the CEO of IKRN, a care management company that provides high quality care management services to individuals who are living with chronic health conditions. Today, I will be discussing the role of chronic care management program in social determinants of health and how it can be used to help our most vulnerable patients. So today, my guest host is Shamika Carter Mitchell, and she will be talking about her experience as a geriatric NP and chronic care management business owner. So Shamika, can you tell us a bit about yourself and what you do?
Sure. Good morning. Thank you for having me again. I am Shamika. I am a adult and gerontology nurse practitioner. I own a practice here in California. It's True Care Telehealth and House Calls practice. We are a specialty practice. We specialize in chronic care management, behavioral health integration, remote patient monitoring, transitional care management, and we do annual wellness assessments for the 65 and older population to help them qualify for these programs. We also go in the communities and we do presentations at senior centers, senior living communities, assisted living facilities to inform the patients about their benefits for chronic care management because just based on my experience, about 90% of them don't even know that they have this benefit, don't even know that it exists. So we go in the communities and we educate the people to let them know you have this benefit. In some cases, it's free of charge. Other cases, there's a small copay, but it's well worth it. So that's me.
Okay. All right. So what are social determinants of health? According to the CDC, social determinants of health is defined as conditions in the places where people learn, work, and play that affect a wide range of health and quality of life, risk, and outcomes. So simply put, social determinants are the non-medical factors, positive and negative, that influence health risk and health outcomes. And so when social determinants of health contribute to health inequities, patients can find it more difficult to access and receive the care and services intended to improve their health and wellness. So Shamika, what are some common social determinants of health?
So the most common social determinants of health that I have run across are, I'll give you three: lack of transportation. Transportation barriers are very common among the seniors. They want to get to their doctor's appointments, they want to get to church, all of those things. And a lot of them have been stripped of their driver's license, so they can't get to these appointments. And then transportation is so expensive. I went to a assisted living facility that we work at, and one of the residents told me that a transportation company comes in there and they charge them $100 an hour to take them within a 40-mile radius of the facility. And they pay this because that's all they have. So transportation, social isolation, nearly 25% of adults age 65 and older are considered socially isolated, including my mom. Unfortunately, social isolation can have a significant negative effect on their health and wellness. It can, it makes their already chronic condition worse. They decline in health because they're in the house, they're not getting out to walk. They have diabetes, they're not getting out to walk. They have high blood pressure, they're not getting their exercises. they're depressed, they're on antidepressant medication for 5 or more years, and they don't know that now their bodies are immune to the medication, so it's just not working anymore. So, and then well, yeah, that's
Okay.
it. And then
All
the
right.
last one is financial barriers. I'm
Yes.
sorry. The
Yes.
last one is the financial barriers. We
Mhm.
know that about 15 million Americans 65 and older are under the federal poverty level. So
Right.
they don't really have money to get their medication, get expensive medications. And a lot of
Mhm.
times what I'm seeing is the doctors are prescribing a lot of these new age medications, and those new
Right.
age medications are
Yes. Yes,
expensive.
they do.
Yeah, so those are the top three: lack of
Mhm.
transportation, social isolation, and financial barriers.
Right. And so just to add to that, I work in hospice. Of course, I also work in home care. And so those are definitely the top three that I've seen as well. Transportation, not being able to get to and from their appointments, sometimes not having someone to escort them to their appointments, and they can't afford or qualify for certain services, and then also financial as well. A lot of patients I see, die in the hospital because their families, they're not able to afford to take them home and provide the care that they need in that setting. And so there are a lot of challenges, financial as well. And then the social isolation, for me here in New York, there are a lot of people that they're just here by themselves. They don't have families, a lot of people migrated here. And so you see a lot of people just dying with no one really there to support
Right.
them. And so, definitely those are the most prominent that I've seen as well, working as a nurse. So how can care managers and chronic care management support patients who are experiencing some of those challenges with social determinants of health?
So I'll go backwards. I'll start with financial barriers. So for financial barriers, we have a lot of programs here in California that can help out, but the waiting list is so long. So for the care manager, in there, number one, assess the patient and see what are the financial barriers. Is it medication, lack of medication because it's too expensive? And if that's the case, then the care manager can either call the doctor's office and see, can we get the medication changed to a cheaper medication, or find samples. I was doing an annual wellness assessment, annual wellness visit on a patient, and he had a sample of this new blood thinner, and he said that he had been getting it for the last 2 years. And I'm like, they supply it for you for 2 years? He said, yeah, I can't afford it. It's $1,500 a month. But my doctor gave me some samples, and just every month the doctor's office give me samples for 2 whole years. So I didn't even know that they can get samples for that long. So that's another way. The care manager can call the doctor and see if
Mhm.
they have samples to give the patients, because these
Right.
pharmaceutical companies give them a lot of
Mhm.
samples.
Yeah.
Social isolation, again, the assessment is very important to see, yeah, why are they socially isolated? What level of social isolation? Are they depressed? Are they anxious? Some people are just naturally what do you call it, shy. They don't go around a lot of people. So if they're living in a community, a senior living community, and the community is having different type of activities, sometimes they just don't want to go down because that's just their personality. Our responsibility as care managers is to assess, find that out, and find other ways that they could be socialized without having to be around a whole group of people. Maybe just them and one other person, or small groups. So the care manager's responsibility is to find ways to keep them from declining from social isolation. And then lack of transportation, like I said, that transportation company, $100 an hour, that's more than a nurse get paid. I'm like, what are they charging? So the care manager, one of my care managers told a patient what we could do is call and get you signed up. We have this thing called Access here in California. Yeah, get them signed up with Access. And then in the interim, while we're waiting for their application to go through, find other methods to get them to and from where they need to go without this huge out-of-pocket cost. Because again, $100 an hour goes back into, you're going to put them in a financial barrier.
Exactly, you will.
Right. So those are ways care managers could help.
Yes, definitely. So, like you were saying here, we have Accessoride, which is similar to California's, I guess, Access as well. And, put in those applications and just kind of knowing what resources are available in the community, is what we try to do, whether it's for transportation, or medication or any of those things that we try to find resources to help the patients, utilize that to help, combat some of those social determinants challenges. So the relationship between chronic diseases and social determinants of health, we know that chronic diseases, they don't just appear overnight, and it's usually the result of years of poor lifestyle, choices, financial challenges as well, lack of education or other challenges that they may face. But chronic care management programs help directly impact the severe effects of chronic diseases because nurse care managers are proactive and ready to, jump into solving a problem and trying to ensure that we help get the best outcome for our patients, whether it's referring them to, social work or whatever resources, like you're saying, in the community that can help them. I know that during the crisis with the water in Mississippi, I believe, Latasha, who is a care manager, she was out helping, her patients get clean water so they have clean water to take their medications and stuff like that, letting them know where they can get those resources as well. So that's part of what we do as care managers, find those areas. So let's say, like you were saying, a patient says they don't have money to pay for their blood pressure medication. You would do what to help them get that covered?
For me personally, I would get in contact with the doctor and see what's an alternative to that medication. There's hundreds of the same medication with the same action. So we don't necessarily have to prescribe the newest and the best. There's older medications, older aged medications that cost like $8 a month that'll do the exact same thing. For example, one of the medications, amlodipine, is for hypertension. And the doctor will take away amlodipine and give them an expensive, the newer, drug on the market. And the patient is saying, I can't afford it, but they won't tell the doctor that. For whatever reason, they won't tell the doctor that. However, they will tell us that. They'll tell their chronic care manager, or they'll tell their care manager all of these things, because we develop a relationship with them over time. We make it easy for them to communicate with us. And if a patient trusts you, they're going to give you everything. They're going to tell you everything, even things that they don't usually talk to people about. So I would call the doctor and see if we could change that medication. And if he said no, it was just something that they had to have, then I would definitely, let him know that we need to find some samples to give them, and we need to see the life of the samples. How long are you going to be able to give it to them? Because we're not going to know how long they're not going to be able to afford it. So if you're going to insist on them taking a specific medication that they can't afford, then you're going to have to afford it. Right.
Exactly. Yes. Yeah, so a vital aspect of the chronic care management is to help identify any outside barriers that could be interrupting the patient's path to better health and wellness. And patients are most successful when they're actively engaged and willing to do the work that's required to improve their health and wellness. And so if they feel, they can communicate with their care manager, they're more likely to engage and do those things to help improve their health outcomes and, manage their disease better. Because care managers, we provide a combination of support, encouragement, education, and connections to community resources to help them overcome those barriers that they may face. They may not always know what help is available to them. And so that's where we come in, to help guide them. So that would be it for me today, and Jamaica, talking on some aspects of social determinants of health. Of course, we will continue these conversations to help educate our community and the nurses as well, our peers, on how important it is to utilize this service and educate communities about the availability of those services. So thank you for listening in. And if you like what you've heard, please subscribe to our channel. And of course, Shamika will share her link below if you'd like to reach out to her. She is in California. And Shamika, can you share any closing thoughts?
Just care management is a newer concept. It is a Medicare-driven program. I feel like nurses should be running the chronic care management program just simply because it's what we do all day, every day. Although there are many others, like attorneys and engineers that are starting chronic care management programs. If you're a nurse and you're interested in what we're talking about, then please get in contact with Natasha. She has an awesome program and it'll help you get started. It'll put you ahead in the game. This chronic care management is care management of the future. It's not going anywhere. It's only going to grow larger. So that's it. Those are my closing thoughts.
Okay, thank you so much, Shamika. Have a great day.
You too. Bye.